Hi, welcome to a 5-minute video study for the NCE. Today we are under clinical focus and we are going to be covering subcategory AL, visual auditory hallucinations in the counseling world. So auditory hallucinations involve the sensory experience of hearing sounds or voices when there's no external source for these sounds. They can occur in both psychiatric and non-psychiatric conditions. Understanding kind of the causes, the triggers of hallucinations can help you identify some of the underlying conditions, as well as implement effective strategies to manage some of the symptoms. So when experiencing hallucinations, it is helpful to look at coping strategies to manage the distress in the moment. So when you seek support, there could be different types of support for clinicians. It's important to understand that medication is usually a type of support in order to help eliminate or diminish the hallucinations, but also counseling is a type of support, and because with counseling there could be some effective interventions. So let's talk about some of the techniques or interventions that can be done in a counseling setting in order to address some of the visual and auditory hallucinations. So grounding techniques, those are focuses on immediate surroundings to anchor yourself to reality. Things like naming objects you see, touching different textures, or listening to calming sounds. Those are, using different senses in order to kind of distinguish between what's a hallucination versus what's real. Deep breathing, taking slow breaths in through your nose, out through your mouth. That can help with the relaxation and redirection of attention. Distracting yourself, that can divert the attention of the hallucination. So again, using your senses, listening to music, watching a show, reading a book, looking at kind of what hobbies you're interested in. That could be an effective intervention. Also, positive talk, reminding yourself of what some of the symptoms are and kind of distinguishing between reality versus non-reality, using affirmations and positive message in order to counteract those negative thoughts or messages. And then, seeking support, seeking counseling, finding connections that you feel comfortable that could offer support, right? So when you seek those connections, you're able to get somebody else's perspective, and they can say, hey, you're saying you're seeing something, but I don't see what you see, and in that way they can kind of help you with that sense of reality. And then keeping a diary, documenting the hallucinations, knowing when you're experiencing greater hallucinations, understanding the frequency, the intensity, the patterns, and that just increases the awareness, right? So the more you know kind of what some of the precursors are to it. So with hallucinations, again, they can occur in a variety of psychiatric and non-psychiatric disorders. Some of the disorders could be schizophrenia, schizoaffective disorder, bipolar disorder, or severe depression. And then just to give you all some statistics, hallucinations are seen in 75% of individuals with the schizophrenic condition. 20 to 50% of individuals with bipolar disorder mention having the hallucinations. 10% of individuals with major depressive disorder report hallucinations. And then 40% of individuals with post-traumatic stress disorder report hallucinations. So again, trauma can be certainly be a trigger. And then there's non-psychiatric hallucinations that are different, right? So things like substance use, sleep disorders, sensory deprivation, neurological condition, brain tumors or epilepsies. Those medical conditions can kind of stimulate those hallucinations. Extreme stress, grief, or trauma, and again, that's very much related to the PTSD. And then migraines, anxiety, or conduct disorders can also be linked to the hallucination. So that's just a little bit of information about what are some of the interventions, what are some of the differences, and what to keep in mind.